Nursing 474, Evidence-Based Practice. The weekly learning objectives for week 4 include explain the current impact and threats of infectious disease on society, explain the steps and principles that guide community health education, use evidence-based practice at multiple levels of the patient system, individual, family, aggregate, and community, choose evidence which will support community health initiatives, and prepare a comprehensive review of the literature associated with your identified problem. Evidence-based medicine has been defined as the conscientious use of the current best practice in making decisions about client care. Evidence-based public health has been defined as a public health endeavor in which there is informed, explicit, and judicious use of evidence that has been derived from any of a variety of science and social science research and evaluation methods. Evidence-based nursing has been defined as the integration of the best evidence available, nursing expertise, and the values and preferences of the individuals, families, and communities that are served. Applied to nursing, evidence-based practice includes best available evidence from a variety of resources, including research articles, nursing experience and expertise, and community leaders. Culturally and financially appropriate interventions need to be identified when working with communities. The use of evidence to determine appropriate interventions that are culturally sensitive and cost-effective is a must. During the mid to the late 1970s, there was growing consensus among nurse leaders that scientific knowledge should be used as a basis for nursing practice. Early research utilization initiatives focused on the process of transforming nursing research knowledge into practice. Parallel efforts in medicine shifted to a new philosophy of medical practice that focused on awareness of evidence as the basis of one's practice and the soundness and strength of inference that evidence had implications for nursing practice. Although clinical experience is important, it is not a sufficient part of clinical decision-making. Knowledge gained from authoritative figures was de-emphasized, and critical appraisal of research literature to apply research findings in practice was stressed. The underlying principle is that high-quality care is based on evidence rather than on tradition or intuition. When evidence-based practice was first emphasized in medicine, the focus was on individual client problems to provide best diagnosis and implement the best treatment. When nursing became involved with evidence-based practice, the focus shifted to answering clinical questions about a health problem experienced by a group of clients. The current evidence-based practice nursing literature is primarily associated with applications in the acute and primary care settings, and little is reported about its use in community settings. Evidence-based nursing is a process whereby evidence, nursing theory, and nurses' clinical experience are evaluated and used in conjunction with the client's involvement to make critical decisions about the best care for the client. Several factors related to implementation of evidence-based practice need to be addressed by nursing and other disciplines. They are knowledge of research and current evidence, ability to interpret the meaning of evidence, the individual's professional characteristics, commitment of time needed to implement evidence-based practice, including engaging in education and directive practice, hierarchy of the practice environment, level of managerial support, and the ability to engage in autonomous practice. Philosophy of practice environment and willingness to embrace evidence-based practice, resources available to engage in evidence-based practice, practice characteristics, and lastly, links to outside supports. Barriers to implementing evidence-based practice occur when time, access to journals, research skills, critical appraisal skills, and an understanding of the language used in research are lacking. Common barriers in nursing are nursing leaders' misunderstanding of the process, inferior quality of available research, inability to assess and use the evidence, unwillingness to fund the research or make decisions using the evidence, and concern about a cookbook approach to care while ignoring individual client needs and the nurse's ability to make clinical decisions. Certain realities in nursing practice may also interfere, such as lack of resources, time, funding, computer resources, and knowledge. reluctance to accept findings, or fear of changing long-established practice. Cost of implementation may also be a barrier. If the client will not follow the recommended intervention, client's compliance may be a barrier. The steps in evidence-based practice. Evidence-based practice is a philosophy of practice that respects clients' values. Using evidence-based clinical practice guidelines is one way for nurses to provide evidence-based nursing. Melnick and Feinholt define a 7-step evidence-based process starting with Step 0. Step 0 is cultivating a spirit of inquiry. Step 1, asking the clinical questions. Step 2, searching for the best evidence. Step 3, critically appraising the evidence. Step 4, integrating the evidence with clinical expertise and clinical preferences and values. Step 5, evaluating the outcomes of the practice decisions or changes based on evidence. And Step 6 is disseminating evidence-based practice results. Current perspectives include cost versus quality. Much of the pressure to use evidence-based practices is driven by the need to contain costs. Therefore, nurses must be critical in their appraisal to determine that the process is not weighted toward evidence that solely favors cost savings without integrating client and community satisfaction and safety of care. Another perspective is individual differences. Evidence-based practice cannot be applied as a universal remedy without attention to client differences. Ethical practice in communities requires attention to the community differences. Appropriate evidence-based practice models for population-centered nursing practice. The nurse must ensure that interdisciplinary community health practice is acceptable to the community, using both qualitative and quantitative research approaches or the best available evidence at the time. The rising cost of healthcare will demand a more critical look at the benefits and costs of evidence-based practice. An emphasis on quality care, equal distribution of healthcare resources, and cost control will continue. Evidence-based practice can save money by providing the best care possible. The Affordable Care Act of 2010 addresses the development of task forces on individual and community preventative services and grants to support the delivery of preventive services in the community. When using the internet as source for evidence-based information, it is essential to evaluate the quality of the information. Healthy People 2020 objectives offer a systematic approach to health improvement and improving clients' understanding of evidence-based practice and how evidence-based practice can contribute to healthcare decisions. Example of an application of evidence-based practice to public health nursing is the intervention wheel. It's a population-based practice model for public health nurses. It consists of 3 levels of practice: community, systems, and individual and family, and 17 public health interventions for improving population health. The model was originally developed as an extensive analysis of the actual practice of the public health nurses using a qualitative grounded theory process to provide a description of the scope and breadth of public health nursing practice. Because of the positive response to this model, a decision was made to complete a systematic review of the literature to support the levels of practice and underlying practice interventions. An expert panel reached consensus on the outcomes of the review, and the outcomes were subsequently field tested and critiqued by a national panel of experts.